Your medical records are about to be reviewed by a private company you never heard of. So, should you be worried? Well, January 2026, 6 private companies have access to review Medicare patient records in 6 states. Here are their names, which one serves your state, and the federal laws protecting your information. So if you are in Texas, New Jersey, Oklahoma, Ohio, Washington, or Arizona, this video tells you exactly who sees your records under Medicare's prior authorization program. The protections and the one valid concern worth knowing about are coming. Hi, I'm Hanh Brown. This is where AI, policy, and aging collide, and where your family fits into all of it. When private companies get access to medical records, the question people ask out loud is, who are these companies? Well, the question underneath is different. Am I becoming invisible? Am I being reduced to data when I have lived a whole life? Does anyone see me anymore? Or am I just a number? Well, that question deserves a direct answer. Well, here's what I found when I analyzed Medicare content landscape. There are videos exist about AI denying healthcare claims. One video titled, AI is Denying Your Healthcare, has over hundreds of thousands of views. Another video called, Medicare Just Approved AI to Deny Your Care, has over 60,000 views. Well, the fear is real, and people are searching for answers. But almost none of those videos answer the specific question. Who are these companies? And what laws actually protect your data? Well, that is why you're here, and that is exactly what I'm going to show you. That gap is why this video exists. 2 federal laws govern how your information gets handled in this program. The Privacy Act 1974 and the HIPAA both apply. These are not suggestions. They are legal requirements with penalties for violations. They're also something worth looking into, honestly. Some of these companies have investors from the insurance industry. That is a valid concern. And I'll show you which companies and which investors, along with what CMS put in place to prevent conflicts. The question is not whether they see your records. It's whether the protections actually work. Well, let's find out. Federal law and CMS contracting rules require specific protections. Well, here's exactly what that means for your data. CMS Wiser model request for applications spells out the security requirements. Every company participating in this program must meet federal cloud security standards. They must comply with federal information security regulations. They must follow CMS security and private policies. And they must comply with HIPAA, privacy, security, and breach notification rules. So each company signs a business associate agreement with CMS. That agreement makes them directly liable for HIPAA compliance. CMS states in the Wiser Model RFA that a business associate is directly liable for compliance with the HIPAA security rule and certain provisions of the privacy and breach notification rules. If they violate it, they face federal penalties, not just removal from the program. So you've heard about data breaches in healthcare, and they happen across industry. These are specific protections meant to prevent abuse of your information. Well, you can look these requirements yourself in the CMS Wiser model. It is public. Now, the 6 companies and their backgrounds are next. So stay with me. The next 2 minutes tells you exactly who these companies are, who funds them, and what that means for you. So here are the 6 companies, 1 primary participant in each state. If you are helping a parent in Texas, Cohere Health is a company reviewing their prior authorization requests. If you are in Ohio, it is Innovacker. New Jersey is Genzian. Oklahoma, Humada Health. Washington, Vertex Health. Arizona, Zeder. The state is assigned 1 primary Wiser model participant for reviews, not all 6, 1. So that means your records go to 1 company, not scattered across 6. Well, let me tell you more about who these companies are. Humana Health was founded by a Mayo Clinic radiologist that describes their approach as build for yes, meaning their technology is designed to find reasons to approve, not deny. Innovecker works with Kaiser on healthcare data technology. Gentian emphasizes human-in-the-loop oversight with over 75 payer and provider clients. Vertex Health specializes in clinical data acquisition and quality reporting, and Zeter serves 45 health plans with their health tech platform. Cohere Health focuses on AI-powered clinical intelligence for prior authorization. So these are technology companies, not insurance companies. But that distinction requires honest examination because some of them have insurance investors. Some of these companies have investors tied to the insurance company. Humana Health, the company serving Oklahoma, has investors including the Blue Venture Fund, which is Blue Cross Blue Shield's venture capital arm, plus Optum Ventures from United Health Group, and Highmark Ventures. Now, Innovecker, serving Ohio, counts Kaiser among its backers. Well, here's what that means for you. The companies reviewing your prior authorization request have financial ties to the same industry that profits when care is denied. That is a fact you deserve to know. So if you are skeptical about companies with insurance investors making decisions about your care, well, that skepticism is reasonable. An endocrinologist quoted in the State Line investigation asked the same question. Would there be safeguards to prevent profit-driven denials? Well, here's what CMS put in place. Performance metrics track each company's accuracy. CMS audits participants, and companies with high rates of inaccurate determinations can be terminated from the program. So critics argue these safeguards may not be enough. The American Hospital Association raised concerns that vendors receive 10 to 20% of savings from averted care, a payment structure that, in their own words, incentivizes denials over physician judgment. Well, that's a valid concern. So now, for how your data actually flows. The data flow has 4 steps, and understanding this matters because it shows exactly who touches your information. Step 1. Your doctor submits a prior authorization request for one of the 17 covered procedures. Step 2. The Medicare Administrative Contractor, the MAC, routes that request to the wiser company assigned to your state. Step 3. That one company reviews it using their clinical intelligence system. Step 4. The decision goes back through the MAC to your provider, then to you. So who sees your records? Well, your doctor, the MAC, one of the 6 wiser companies, just one. The one in your state, and CMS for oversight. Who does not see your full records? Well, the other 5 wiser companies, private insurance companies. Well, this is original Medicare, not Medicare Advantage. One important clarification. MAC already handles claims administration for original Medicare. Wiser adds one company to the review process for prior authorization. Your data was already being handled by federal contractors. So now there is one additional contractor with the same legal requirements, plus legal standards specific to Wiser. So that is the official CMS position. Access is limited. Use is limited. Federal law governs all of it. This is not a promise. It's a legal requirement with penalties for violations. So if they break it, they face federal consequences. You can verify this yourself in the CMS Wiser Model, the FAQ section, which is question number 7. Now, for those helping a parent navigate this, only one company in your state is assigned to review those records for Wiser, not all 6, one. So that is the protection. Here's what you can do, with your information. Knowledge is protection. Here's how to use it. You now know which company serves your state. Write it down. If you are in Texas, it is Cohere Health. Jersey is Gentian. If you're in Oklahoma, it's Humada Health. Ohio, it's Innovacker. Washington, it's Vertex Health. Arizona, it's Zeder. Well, these are names that you can search. Companies that you can research, entities with legal responsibility. And here's what changes for you. Your records now go through one additional review step, but that step is governed by federal law, monitored by CMS, and limited to one company in your state. So your data is not floating across 6 companies, it is contained. Your appeal rights remain intact under this program. If a prior authorization request is not approved, you have the same appeal process you always had. A human clinician must review every request that might be denied. AI cannot be the reason your claim is denied by itself. If the answer might be no, a licensed clinician has to make that call. A human review requirements exist specifically because CMS wanted to prevent algorithm-only denials. So the next video covers exactly how the appeal process works. You see, CMS audits these companies and monitors for inappropriate denials. Remember the CMS quote from a moment ago about limiting access to your information? Well, that is not aspirational. That is the legal standard these companies agreed to meet. Companies that fail to meet accuracy standards can be removed from the program. So if you are helping a parent with Medicare in one of the 6 states, you now have the company name, the legal protections, and the accountability mechanism. This is shareable information. You can explain it to your family or your doctor. Here's what you can tell people. Medicare now requires prior authorization for certain procedures in 6 states. One private company in each state reviews those requests, and the federal law, including HIPAA, governs how they handle your data. Your appeal rights stay exactly the same. If the answer is no, a licensed clinician has to make that call. So that's a summary. One sentence you can share with anyone who asks. So have you ever had concerns about who sees your medical records or had a privacy issue with healthcare data? Tell us in the comments. What happened? So which of the 6 states are you in? Drop it in the comments. Remember that thing CMS can do if companies abuse their access? Well, they can terminate them from the model entirely. The CMS FAQ states explicitly, participants who have a high rate of inaccuracy may be terminated from the model. That is accountability mechanism. Companies that abuse the system lose access to it. So this is about transparency, not fear. You now know the companies, the protections, and the oversight. When you see videos with titles like AI is denying your health care and millions of people have watched them, remember what you learned here. The fear is understandable. The protection are real. Both things can be true, but your job is to know both. So I'm building Medicare Brain, a tool that answers your Medicare questions instantly with source links that you can verify. Every fact in this video came from the official CMS documents, and Medicare Brain will give you the same level of sourcing. So drop Medicare Brain in the comments for early access. So the next video covers what happens when claims are denied and exactly how the appeal process works. Your rights in that process have not changed. One company, one state, federal law, your data protected. So now you know the names and you know who's responsible for protecting your data.